Cancer Holistic Guidance, Part 20. Dr. Dilip Gadgil, Pune. When scans are done, the biopsy happens, and FINOC tests happen, there is a feeling of fear amongst the patient's family members. How to deal with cancer is a huge concern for most people. Most doctors say that in most cases, cancer is only diagnosed when it reaches a critical stage. If a third or fourth stage cancer is detected and the doctor says that there is no chance of curing it, the fear levels increase even more. Giving this news to the family or patient is not easy. Now, if the patient isn't composed or tolerant, their family members start to panic even more and the situation worsens. At the moment, most people only know about the modern medicine perspective to addressing cancer. A tumor has been formed and it is causing certain symptoms. Removing the tumor through surgery, radiation, and chemotherapy is the only option for them. They aren't told about the reasons or causes. It is understood that cancer can happen to anyone and at any age. And after all this, it is still difficult to say what the chances of recovery are. An atmosphere of fear and panic makes things worse. In Ayurveda, we believe that when we are incapable of doing anything, that is the highest form of fear. The fear levels are at their maximum when we come to know that nothing can be done to save your loved one. On that note, let me share an anecdote with you. I was in the clinic when I got a call from our registrar one evening. He said that there was an urgent case and he was sending the patient to me. It was a case of acute leukemia with 95% blast cells. The patient was an employee of our college. When he came to me, I took his history and gave him some medicines. I asked him to come to the college since that would be a more affordable and convenient option than visiting the clinic or hospital. Before coming to me, he had consulted an oncologist who had told him that even if he spent 4 rupees lakhs on treatment, there was no chance of recovery. The patient had slipped into depression. His financial state wasn't great and he had kids who were studying. His brother collected donations for his treatment and he underwent chemotherapy. Remember, the oncologist had told him that chemotherapy was useless in his case. However, the doctor still took advantage of the patient's desperate situation. We need to think about these things.